In this episode, we talk to health coach and pharmacist Dr. Jessica Messa about alignment and purpose, mental health, codependency, taking care of yourself through meditation and diet, and many other great subjects. This is one of my favorite interviews so far. It has a lot of impactful and helpful information for you. I hope you stick around and watch it. Stay tuned. All right, guys, before we get into that interview, make sure if you haven't already, subscribe to the channel by hitting that subscribe button. Smash that like button at any point during this interview. If you like it, it helps share it with more people. And as always, make sure that you hit that notification bell so you can be notified each time we upload a new episode. So with all that being said, let's get into the interview.
Hello.
Hey, how's it going?
It's going well. I love your setup.
Oh,
How's it
thank
going
you.
with you?
It's going pretty well. I'm very excited to do this.
Yeah, me too. I'm very excited and I'm glad you asked me.
Yeah, so wow, it's been a long time. For anyone who does not know, me and Jessica go way back, like probably kindergarten, you know what I mean?
Yes.
So yeah, and then here we are many years later, and we're going to be talking about some really fun stuff today. Um, I've seen you post, I guess, the past couple of, I don't know, months or something, maybe, I guess, here and there about little topics. And I suppose I'm just assuming this kind of has to do a lot with what you learned in college. From what I understand, you have a doctorate in pharmacy. Is that correct?
I do. Yes. Yes. I am currently a pharmacist and also a coach.
Okay, so that kind of helps me understand a little bit because I was kind of wondering if you had stopped pharmacy and kind of just went into a more mental health approach, or if it's like kind of both of them are a passion. So I guess if you want to give kind of like a little bit of introduction of yourself, because you could probably do it better than I could,
Yeah.
kind of, yeah, what you're doing now.
Yeah. Yeah. So currently I am still in the pharmacist space. But I have realized over the years just how much of a passion I have for mental health. I guess you could call it mental health. For some reason, I don't think of it as mental health, but I just think of it as like the human experience, basically, like what it means to be human and the way that we feel and the experiences that we have, and how to like work through those with intention, I guess I would say. And I feel like most of like the what I build off of and what I teach within coaching, that is from my own experience, from my own research and practice, and then a desire to share that with other people in the hopes that they can also benefit from what I've learned and everything that I've taken in as far as yeah, just what it means to be me and how I can show up. Yeah, I'd say that's about what my background right now.
Okay, yeah. And I know, like, it's strange, because I find myself like very passionate about a lot of those same topics right now. So I think that just with our conversation today, we can both kind of share a lot of things that can be helpful to others. That's kind of the big reason why I wanted to have you on. So thanks again for coming on.
Yeah.
So first, I guess let's talk about this idea of alignment and purpose, and kind of how we can feel a lot of things like anxiety and different emotions whenever we're not following that, and then how
Mhm.
we can kind of come back to that.
Yeah. So I actually recently came in with this thought, which is that anxiety is really a symptom of something else. And kind of like you're saying, it's like a symptom of not being in alignment, basically. And so, really, when we're experiencing anxiety, there's something deeper to look at. I think sometimes we hear or we think that anxiety maybe is normal in certain situations, that it's normal, but really it's our body's way of communicating we're not in alignment. There's some things to look at. We have to dig deeper a little bit. And so that's the first thing I would say is that, yeah, you know, when our bodies are communicating to us, there's something to do there. There's some place
Mm-hmm.
to go. And I think, yeah, really listening to your body. So first of all, anxiety can tell you there's something to look at. And then there's kind of maybe diving into your thoughts and like feeling into them and seeing in your body again, am I getting like a resistance, kind of like a, ooh, I don't really want to do that. Maybe I feel like I have to do that, but I don't want to. Like my body is saying it doesn't want to. And just kind of noticing that. So I feel like the first step is kind of noticing, or you might have a thought that's really powerful and really makes you feel like grand and very in alignment, basically. And then maybe you might have another thought that's like, but you can't do that. But that's just, you know, that's just the story in our head. But
Right.
that first, like, ooh, I liked that. That is really like, okay, where can I go with that? And so for me, that's really like checking in and feeling into where you're aligned in alignment and where you're not.
Right. So there's a lot of areas in life that could be relationships, that could be careers, that could be friendships,
Mhm.
could be a decision to move somewhere. You know, what we're talking about is this, like you said, that spark of that when you get those ideas, they bring certain emotions, and you know, it's either following that sometimes or just kind of recognize a way that it makes you feel, and
Mhm.
it could be, you know, sometimes that can be kind of changed, right? Like sometimes we need to do that. We need to look at the way that we're looking at a certain situation, because it'll bring a certain emotion. So, you know, that really affects us a lot. Um, what are some ways that people can kind of bring themselves back into that area of alignment?
Yeah. I would say I feel like let's see, like if we're going and we're in a direction that we really don't want to be, like
Mm-hmm.
maybe we have an emotion coming up or we're being triggered basically. Like let's say we're being triggered and like this crazy energy is coming in or like really intense anxiety is coming in. So something that we're like something's happening. The best thing to do is to like become centered. So become still, and then we can move into a more positive space once we become still, because it's like a pendulum swing. Like when we're like in a state where there's resistance, anxiety, anger, fear, like all of that, we can't just jump over here. We can't just, you know, put a band-aid of positivity on it. We can't just start only thinking positive thoughts, because sometimes we'll think positive thoughts and there's still resistance in that because we don't really believe it maybe. And that's
Mm-hmm.
okay. Like we can move and eventually find ways to like solidify those positive mindsets in our mind. But I would say that the best way in a really like in a moment is to try to find yourself back at zero, which is neutral, which, you know, a lot of times this basically means learning how to meditate is so powerful because of that, because it allows you to come here and it allows you to go somewhere else.
Right. Okay. So I'm glad you brought that up, meditation. Define meditation, because I know that it can be different for a lot of different people. But what's, I guess, helped for you, for example?
Yes, meditation is a practice, and you're right, it looks different for everybody. And it can be guided meditation. So that's how I started, by using an app with guided meditation. So there was somebody basically, you know, gently talking me through something, exploring something, or just being still. And it takes practice. I mean, I remember when I first started trying to meditate and I couldn't be still. I couldn't, like, you know, I was just go, go, go. That was just my lifestyle. And so it took a long time. And I remember like one of the first ones that I did was a 1 minute meditation. And it was a 1 minute guided meditation to where just being still, listening to your breath. But yeah, so I started with guided meditation, and then you could move into, you know, silence. You could do listen just to music, You can go for a walk and be with nature. You can work out. Sometimes working out for people allows them to really like just come into their body and out of their
Mm-hmm.
mind. And
Mm-hmm.
so that is also like a way to be just present and still.
So would you say that all of those are about coming like back inward as far as kind of like just being self-aware right there in the moment of kind of what you're doing?
Hmm. Yes, because our minds are like so powerful. And and I've even really recognized very recently that I'm starting to get in that to that pattern a little bit where like my mind is taking over, it's having me like zoom into something and not zoom into myself. Like so I'm zooming out of myself and I'm feeling just less connected and present and here and aware of what I'm wanting in this moment, what I'm needing in this moment.
Mm-hmm.
And
Just being kind of pulled by different things all the time.
right, right. And so, yeah, the mind can, take you places. And so it's helpful to come back to center, come back to stillness, and you can get like a fresh perspective of what it was that was taking you somewhere.
Okay. I could probably keep on going with that, but for sake of time, we'll go to another topic.
Okay.
Dependency. Let's talk about
Mm,
dependency and kind of like how that can play a role in our life and everything else. So I guess let's start off with, for those who aren't familiar with the term, what is codependency?
yes. So the first thing I guess I will say is the common narrative or the common thing that people think of when they hear codependency is, oh, it's a person that has to be in a relationship. It's a person that can't be on their own. And when I was younger, that's what I thought as well. When I would hear that, oh, they're codependent, I would think, oh, they just can't be, single. They can't be single, basically. But codependency goes so much deeper than that. It's really a way. It defines how we communicate, we interact with other people. It highly influences us. So a lot of, and really, it comes all the way back to the way we were raised. And so that's another thing is I think it's hard for some people to hear the word codependency and think that it might be a part of them, that they might identify with some of those aspects. And it's because there's this idea that maybe there's something wrong with me, which is actually codependency in itself. Oh, there's something wrong with me. There's something wrong with me. I'm unlovable. Bad things happen to me because this, or this. But codependency develops when we are young and we develop codependent habits. And that can look like people pleasing. That can look like being in a toxic relationship and just not knowing how to stop it. And like you can see it, but you don't know how to leave it. There's this draw towards it. Um, but yeah, and just self-value, like, yeah, I don't think I'm enough. And again, so that's really not something that somebody that's really struggling with codependency, they're not going to think, I don't think I'm enough. That's
Mm-hmm.
kind of like a deeper dive. Um, but yes, codependency affects us in all areas of life. It affects us in relationships with our families, relationships with loved ones, friends, in our work and career. It can show up.
So now, from I guess my idea of codependency, and I kind of want you to tell me if I'm off the mark or not, but it sounds like sometimes it's this way that, or like I guess you'll see it in people who have well intentions, right? They mean well, but they'll sacrifice so much of themselves,
Mm.
give to someone else that may or may not even really deserve that help or need that help. Um, and it's like, as you, like, it's not your job to really, I don't know, not fix, but necessarily be that corrective course of action for somebody or help for someone. And you see them give away much of their time and their life and their, um, I guess, like their own mental health and everything for that person.
Hmm.
And it's that like that's being I guess codependent. Is that right?
Yes, yes. When you're saying that, it's bringing me back to where the word codependency came from in the first place. And so the word codependency came about as a way to describe spouses that were staying with an alcoholic, so dependent on alcohol, dependent on drugs. So this, you think about a person, yes, that is not, treating themselves right, they're addicted. And then there's this person, this codependent, like with this person that's dependent on drugs and alcohol. And codependency, that term came about from that. And like you're saying, it's self-sacrifice, it's staying when that person, like, you can't help them, that person has to help themselves. However, you're staying there and trying to sort of, like you said, fix it, help them, and continue doing that. So yeah, like self-sacrifice is very common within codependency, and giving more than you have to give. And a lot of times it can be a way for us to think that that's how we provide value. It's almost like we were taught that that was the only way we could provide value,
Hmm.
is to give, and never consider what we need.
Yeah.
We're always outward focused.
So yeah, I can see how that can be in so many relationships, even towards, a bad parent or sibling and then, when it comes to dating, I think of two examples and it's kind of like the most, I guess typical, stereotypical, where you have the girl who she keeps going to guys that, she knows are bad for her, but she
Mhm.
thinks that she can change them, right? I kind of think of that, and I don't think that that's kind of too far off. And then guys, the same way. There's some guys who, and excuse the reference, want to be the Captain Save-A-Ho, where they find a girl who's clearly has some problems and some issues, and he thinks that he's going to change her and get her to turn around. Um, I think that sometimes, like, there could be that codependency kind of, like you said, built in from us at a young age. And so we take that trait and unfortunately causes some, relationship type problems later on down the road.
Yeah. Yeah. I think it's so powerful too that you mentioned that this is not like for just one gender. This is a human experience for males and females. And yes, it's something that shows up for all of us. And it's, yeah, it's codependency. Another thing that I feel like is worth just mentioning, I don't know, we'll go far into this, but it's worth mentioning that codependent people are naturally drawn a lot of times to toxic people, to narcissistic behavior. And so a lot of times codependent people will be in unhealthy relationships. And like you said, they started in family, they continue in family. So it is an experience that they're in their family. And then it moves into, yes, like relationships and things like that, romantic relationships and all relationships. Um, but yes, so it's important to know, codependent people are at risk for harming themselves and also being harmed. So it's definitely something worth diving into if, and if people resonate with a few of the attributes of codependency. For me, people pleasing was huge. It was huge. I would, somebody would ask something of me, and my automatic response has always been yes, yes. Oh, you need to, yeah, yes, yes. And it was so much practice for me to have somebody request something of me. And then I would create a buffer so that I would have a moment to think about what I was going to say, yes or no. And I would say, can I think about it and I'll get back with you? So that then I had some space. So,
Hmm.
like, but it was a knee jerk reaction, yes. And I really had to create different practices so that I could really assess, and so that I wasn't reacting from a place of people pleasing. So,
So that can be kind of that first step antidote is to create a space where you can think about if that's something that you actually want to do for yourself or not.
right. Yeah.
Okay. I guess another thing I want to talk about is journaling. Um, journaling, from my understanding, is a great outlet to dealing with stress and anxiety, things like that. And again, journaling can be different for a lot of different people. What are some of the ideas that you've come across and practices that you've come across with journaling that work for you, and kind of like what are you doing? What are you writing? About that really draws it out and kind of helps you unload.
Mm-hmm. Yeah, there are tons of kind of like meditation. There's tons of ways to also journal. And you can always just, yeah, follow whatever feels right. Um, for me, I guess let's just talk about. I think there's conversation around gratitude journaling, which is really beneficial.
Hmm.
So it really kind of helps us to recognize the blessings that we have in our life and the things that we're grateful for, and
Okay.
that brings us into a more positive energy, which is wonderful. So if you're really not doing well, like mentally, you're having a hard time, you're not in a good space, gratitude journaling is definitely a good idea, something that you would do every day. And journaling in general, when we're not feeling well, journaling every single day for a certain period of time, maybe forever, maybe just for a week, maybe 2 weeks, maybe longer. But the consistency, I would say, is really where you find the magic and the release that's looking to be released. So for me, I do a journaling practice every morning for the most part. I will wake up, that's part of my morning routine, is that I'll pull my journal out, I'll be drinking my coffee, and I write really about anything that's coming through. If I happen to have had a moment where I was triggered, maybe the day before, and I'm like, man, I was triggered by that. That's so interesting. It feels out of alignment, like I don't want to show up like that. I wonder what that was all about. And I will just, kind of dive in, maybe describe the situation again to myself, and understand it from basically a different perspective. Because that's the thing, is what journaling does is it takes what's in here, it takes what's in our body, what we're feeling in our body, and it puts it on paper so that we can see it from a different point of view. And it's so helpful. And it also, our mind is holding this emotion or whatever's happening in our mind, and for us to be able to unload it, put it on the paper so that it's there now. Our mind is now freed up to assess, maybe, problem solve what's happening here, what can we do differently. I would say that for people that are new to journaling, that it doesn't come naturally to them, a really good practice is to set a timer and say, I am just going to write, you know 2 pages, or I'm going to write for 15 minutes. And if you feel stuck and you don't know what to write, you can write, I feel stuck and I don't know what to write. I told myself I'm going to write for 15 minutes and I'm feeling like I don't know what to write. But creating that, initial stream, just getting things out, is really helpful for practice.
Yeah. I need discipline there because I can start even doing what you just said, like I'm just writing, and it's like I'll do it, and I guess you're right. I guess I do kind of feel like, all right, well, cool, I got that off, but to continue and to because I from things I've heard that about journaling, like you can go back and kind of see where you were as different areas of life, and again you kind of view it different or see how you've changed. So that can be kind of a lot of fun, like almost going in a time machine of your own thoughts and stuff like that. So
Yes, most definitely.
anything else about journaling you want to kind of maybe add?
um I think so, like you're saying, kind of the you might be maybe feeling something strongly, and so you're like, okay, I'm gonna go journal. And so
Hmm.
you go and you journal and you write it down. And then you start to feel a little bit better. And you're like, okay, I'm cool. I don't need to journal. You know what I mean? It's fine. Like, I only use journaling when I need to. But I will say that it is so beneficial to also journal those beautiful moments, like those
That's
happy
nice.
moments in life.
Yeah.
And so it's for both. It's for times when I'm struggling, times when I'm so excited that I just want to like share what I'm feeling.
Right.
And the consistency, so even like, let's say you're neutral, let's say you're not even feeling like intense on either side. It's the consistency of journaling where you're going to see your biggest progress, like out of yourself. Because we see that when we do journal that, wow, okay, I feel better. Like imagine if you just kept journaling, like, and you kept watching yourself unfold and kept seeing what's coming up next. Like your progress, your just development, self-development it's so much, I don't know, consistent, and you're getting to watch it in real time. So that's another thing that I would say, that why I think journaling is so wonderful as a practice, as a daily practice.
That's great. I love that. I'm glad I asked.
Yeah.
Let's see. Burnout. That was one that you recently talked about. So I guess just sort of like define kind of what burnout is or was for you and kind of, walk us through that.
Yes. Burnout. So burnout is something that I think, again, and that's the thing, is I think a lot of times we use words and we hear words and we hear them consistently. And it's not until it really clicks that you're like, oh my gosh, that's me. So like I never would have identified with having burnout until this last episode of Burnout. And I recognize that this is not the first time that I have been in burnout. I just didn't know it was called burnout. And it's basically just when, and burnout is, it's not something that just happens. It's basically when you are putting forth more energy and more effort to something and the reward is not being met, whether that be accolades, words of like, validation from someone, whether that be monetary. So we can see this in work, which is where I was experiencing my burnout. I was hoofing it. And I will say, I mean, COVID, the circumstances within COVID and how a lot of our work projects became like, a lot tighter as far as a time width, because we were on pause for so long within COVID. And it was like this, like, okay, we're back on and we're going to do all the things that we were planning on doing. And so in order to do that, there was so much effort, so much preparation, so much that I was giving. And it was outweighing the amount that I was giving and needing to give in this situation was more than the reward that I was receiving in whatever way that is, recognition for my hard work, just things like that, basically. And so that's really what burnout is when there isn't a balance between what you're giving out and what you're bringing in. There has to be a balance here. Otherwise, you'll continue, and you'll find yourself in burnout. And something that I recognized with myself was that my burnout happens on a mental level. So there are stages of burnout for myself. This is something that I just learned. This isn't something that I researched, but something that came in for me was that my burnout goes from mental burnout. And if I don't listen to the mental burnout, that I'm not having fun anymore, this isn't like a good time for me, it'll move into physical burnout. And so that was what I was really experiencing a few weeks ago. My body was mad. It was like telling me, you need to sit down, like you need to stop what you're doing.
What
And
were
so I
the
started,
symptoms that your body was having that was telling you that you're on phase two, basically?
yeah. Um, a lot of it sounds really bizarre, but it was like a skin sensation. Like it felt like my skin was on fire. And that was just for me. Again, that's just my personal symptom. But my skin was on fire and I had no energy to do anything. And I was in such a state of discomfort basically within my body that the only thing, and it didn't even really make me feel better, but it was like I knew that was what I had to do, was sit on the couch and close my eyes. Like, stop doing what you're doing. Like, just stop. And so it can show up as a lot of different things, though. Different people experience the physical part of burnout in different ways. It can be fatigue. It can be muscle soreness. You could feel like you're sick, like, basically the way that our bodies tell us that we need to stop because we need to heal from, an infection or something like that. So it can be that kind of thing as well. But yeah, so just to close that though, so starts with mental burnout for me, and I think that this is something that most people might be able to resonate with. Mental burnout into physical burnout if I do not pay attention to that. If I don't pay attention to my physical burnout and continue to push forward anyways, then it becomes emotional. That's when the tears, uncontrollable, I can't contain my unhappiness and sadness. And that's where it'll come out in that way.
That's great. I'm glad you shared all that. I mean, I don't know, because like I said, I guess burnout can be a lot. And most people, when they hear burnout, they're like, oh, he's just what, tired of going to work every day, or maybe he needs more sleep, you know,
Mhm.
but there's really so much more to it.
I honestly think this also ties all the way back to what we were talking about in the beginning, which was alignment. So, we have to listen. We have to listen to our bodies. We have to listen to what is coming through. And that is our key to finding, where are we out of alignment? Where am I
Hmm.
out of alignment? And that's really, I mean, that's another way you could think about burnout is, I'm out of alignment somewhere that's causing me to feel like I don't want to do this. I can't do this. Like I'm just shutting down. And I guess it's like, it's important to recognize that there's nothing wrong with you. Like it's not a matter of like, why can't I keep up? Like, why can't I just make myself do it? Like there's something wrong with me. I can't like do it like everybody else is doing it. I see them over there and they're fine doing the exact same thing. And it's like, there's nothing wrong with you. Your body is telling you, your mind is telling you, we're out of alignment somewhere. So let's take a look. What's wrong? What's causing me to feel this way? And sometimes, I mean, they're big things that you're having to touch on, like your career choice, like a relationship that you're in, like the things that you've committed to within your home that you're saying, I will do this out of, whatever the reasoning may be. Um, and that can be scary for people sometimes. And I understand that. But I would just say that it does, nothing has to change all in one day, all in one night. Awareness is the first step of everything. And awareness is great. And you can sit in awareness for a while and just hang out there and just be aware that something's not right. Something's not right. Something doesn't feel good right here. And I'm just going to be here and recognize that. And then, and then you can take action slowly but surely. You can take it overnight if you want, if it feels in alignment for you to do that. But yeah, I guess that's another thing is that it's okay. And we don't have to change it right away, whatever it is that we see.
That's good. Yeah, you're absolutely right. I mean, just like you said, just recognizing it is like, almost enough, because at least you're seeing it. Now you can think about kind of how to move next with that.
Mhm.
Let's talk about diet for a little bit. So,
Yeah.
because the stomach has so much to do with our brain and the way that we think, because there's so much. They're pretty much connected.
Mhm.
There's so many nerves, millions of nerves in our stomach, and that affects our mood and how we feel a lot and our energy levels. And I know your diet is very clean from what I see on Instagram. It's probably the cleanest thing you could do. It looks like you're going straight farm to table, and no meat, might I add.
Mm.
So let's talk about that a little bit.
Yes. Yes. What we eat. So yeah, it's really important. And it really, like you said, it affects our mood. It affects the way that we're able to show up in the world. Um, so yes. So something that's kind of interesting, like I am a pharmacist. And so, a lot of times when people think about a pharmacist, it's a person that is, dispensing medications for, different disease states. but I feel so passionate about the fact that there are ways for some disease states, so like diabetes, hypertension, we can reverse that. There's a potential for us to be able to have patients come off of those meds by looking at diet. And so I just feel like if people would start to think about the food that they put into their bodies as medicine, they wouldn't be having to go to the doctor as often. They wouldn't have to be picking up medications that have side effects that are uncomfortable. Like there's this like more simple approach to health really in general. And it's just taking a look at what we're taking into our bodies. And I think, again, it's important to note that we don't have to change everything overnight. And I think people get overwhelmed. And that's one reason why people stay in their unhealthy eating habits, is because they see somebody that's like eating really, really healthy. And they're like, I can't do that. I can't do that. I can't do that. Like, I'm still eating fast food and drinking Cokes, and like that feels good. And I just can't see myself over there like eating vegetables and fruit and,
All
I
that
don't eat.
turmeric and garlic and apple
Right,
cider
right. So it gets
vinegar.
intimidating. It's
Yeah.
intimidating. But just know that like that's okay. And but yes, so it's just a matter of one baby step, like just choosing to do one thing different for however long you want to do it different. Um and but like you were talking about though, our gut is so connected to our minds. So serotonin, again, anybody that maybe is on a anti-anxiety or antidepressant, I don't know if you guys know this, but SSRI, so serotonin reuptake inhibitor. I'm wondering what the other S is, but serotonin reuptake inhibitor is what an SSRI is basically. And so it increases serotonin so that we can feel better, because it's one of those neurotransmitters that helps us to feel better, in a better emotional state. But our gut makes tons of serotonin, tons. The majority of our serotonin comes from our gut. So if we have a healthy gut, that means we have positive neurotransmitters floating around in our body, and then it helps us to feel better emotionally. So, but when we're eating processed food, when we're eating fast food, when we're eating and drinking things that are harsh, that are not, not natural, basically, then we start to get inflammation in the body, and then inflammation in our gut, and then our gut cannot make serotonin. And so then like it's really kind of a cycle. It really is.
Wow. That's powerful. I mean, I'm so glad we're talking about these things. So, I mean, are there any particular foods, favorites, I guess, if you will, like ones that you have found have been like, you start trying, and you're like, wow, this is super beneficial.
Foods. I think that what I would say, and this is one approach to trying to start to eat more healthy, is the crowding out idea. So the crowding out theory. So a lot of times, again, it can be difficult to think about eating more healthy when you think about pulling something out of your diet and there being this kind of lack mentality. Because that's like, ugh, I'm depriving myself of something that I want, basically. And so one approach is to crowd out. So you're not eliminating these, foods that you are like, okay, I know these really aren't that good for me, but they taste good. And then, so I continue to eat them. You can add more. So add more vegetables to your plate and just kind of like crowd out and create a smaller space for the unhealthier foods that you're eating. And so slowly just adding in healthier foods, so vegetables. And, so I eat mostly vegetarian and vegan. However, I do eat meat sometimes. I eat meat whenever my body tells me I think that we should eat meat. So that's
Okay.
just me being in tune with myself,
Yeah.
and not putting restrictions, really hard restrictions on myself.
Hmm.
Um, but yeah, so the reason I'm bringing that up is because even though I eat mostly vegetarian and vegan, I don't like the idea of salads for the longest time. I was like, no, I don't want a salad. So like, just so you know, like if you don't like salads, that's okay. Like there's other ways to get fruits and vegetables into your diet. Um, so I think that's what I would say as far as, because I can't think of a specific food. And that's the thing is like, it's really just experimenting because you will like some vegetables and fruits and you will not like some vegetables and fruits, and that's okay. Really, the biggest thing is getting a colorful, variety within your diet so that you're getting all of the different nutrients and benefits that are coming from food that our body needs.
Okay. I like that. I like that. I've once heard somebody put it like, if you go to the grocery store, stay on the outside perimeter.
Mm.
That's where everything is fresh, and
Yeah.
the inside aisles is all the processed stuff. So, that,
Yes.
anything else that you want to bring up or talk about that you think could add to this conversation?
I think just recognizing, I think there's a lot of times we feel I don't know, helpless, if you will, with our mental, with our experience basically in this world, because we're having an internal experience. And like all of the emotions that we feel and everything, that's always like our internal experience. And nobody can see that. That is something that is felt only on the inside. And so, kind of making friends with your internal experience through some of the things that we talked about today, and having compassion for your internal experience. So, a lot of times when we're not happy with a reaction that's happening or something like that, we can maybe like have that reaction and then start like judging ourselves for having that reaction and everything like that. So I would say, really allowing yourself to fully experience everything and not judging yourself, because you're not the only person that has had a reaction like that. And it doesn't make you a bad person. Like, let's say if you're mad, or let's say you get anxious and you don't show up how you want to, or, anything, you're forgetting everything. It's so easy to be hard on ourselves and to not be kind to ourselves. But like the way that we talk to ourselves is so important. I actually recently posted a little bit on that on Instagram recently too. If I was going to say there was one thing that will absolutely change your experience, is how you talk to yourself, and catching yourself when you are not talking kindly to yourself, catching when you're being, just hard on yourself. And again, it's just first step is being aware and being like, oh, wow, that wasn't nice. Like, I wouldn't say that to anybody else. I don't know why I would say that to myself. And just being in that awareness and then slowly moving into a different space. And something that's really powerful with connecting to yourself and practicing the way that you talk to yourself is something called mirror work. So literally looking in the mirror, being with you, and talking kindly to yourself in your head. It can be in your head. It can also be out loud. I will say this practice is something that is a practice. And I would encourage everybody to take a look in the mirror and see what happens, because a lot of times it's very scary the first time you look yourself in the eye and are present with yourself. And so,
But it
yeah,
doesn't
I
work
would.
once. It doesn't work once. It's got to be a practice, right?
Yes, yes, it's a practice. And so, yeah, so first I would just say practice gazing into your own eyes, not saying anything really to yourself. And then practicing eventually that internal dialogue as you start to get more comfortable. So it's really crazy because it's just going to be you. It's going to be you in the mirror. There's nobody else around. But it'll be interesting as you observe what kind of thoughts come in. Maybe you start judging yourself for looking in the mirror, like you judging yourself for whatever. And so that's a really good practice to like start to become more just in tune with yourself and practicing positive self-talk, and being better, yeah, to yourself.
I'm glad you mentioned that, and I'm researching a lot of same topics right now, different therapists and doctors who are talking about that same thing. It's so much right now about, like you said, how you talk to yourself, what, the kind of, the stories that you tell yourself about even different events. It can be the way that people treat you. It can be relationships, it's so, and then, again, also kind of about your own self-esteem and self-love, like how you talk to yourself about yourself. It's just super important.
Mhm.
Thanks for everything, Jessica. It's been really awesome. I guess where can people find you online if they want to kind of learn more about what you're doing?
Yeah, right now the best place to find me is on Instagram. And my handle is JD Messa, so JDMESSA. But yeah, that's really where I share most of my information right now, and that's where you'll see, yeah, just different opportunities to work with me and things like that.
Great. Well, Dr. Jessica Mesa, thank you so much for coming on. This has been definitely my favorite interview thus far, because this is just stuff that I am passionate about, and I want more people to pay attention to, and I want this conversation to be had amongst everybody in the world, because I think that it can help a lot of people. So thank you so much for coming on today. We'll have to do it again, do kind of a follow-up, and talk more practices and things like that in the future.
Yeah, I love that. That would be great. Thank you for having me on. I'm so
Absolutely.
happy that I was here.
Awesome. Thanks. Bye-bye.
All right, bye.
All right, guys, thank you so much for watching that interview. As I said at the beginning, that was one of my favorite interviews to do. I really hope that you got some value out of that. If you did, make sure you hit that like button, subscribe to the channel, because we'll be putting up more content like that. You can even watch some of those videos by clicking right here and right here. And until next time, guys, take care.